Hello, everyone. I'm Joy Reid, and this is the Reid Report. And we're watching major developments in Dallas, where Ebola patient Thomas Duncan remains in isolation in the hospital, while family members he had contact with are now under supervised quarantine.
We just pray to God for everything to be okay with us.
We'll also have a live report from Liberia, where a freelance cameraman working for NBC News is the latest American to be infected. But let's start with the latest on Ebola here in the U.S. In just over an hour from now, senior administration officials will hold a briefing on the U.S. government response to the Ebola pandemic. We'll bring that to you live at 3:30 Eastern. On the ground in Texas, the nephew of Thomas Eric Duncan, the Liberian national being treated for Ebola at a Dallas hospital, tells NBC News his uncle is improving. Right now, 5 days after Duncan was hospitalized, the apartment where he was staying and where 4 of his family members are currently being quarantined is finally being sanitized. Meanwhile, the parents of freelance journalist Ashoka Mukpo, who was working with Dr. Nancy Snyderman's NBC News crew in Liberia when he tested positive for Ebola this week, says he is in good spirits.
His spirits seem better today. I think obviously he's scared and worried. He's been filming what's happening in Liberia for 2 weeks and seeing the death and tragedy, and now it's really hit home for him.
Mukpo, Snyderman, and the whole team will be transported back to the U.S. this weekend. And Dr. Seema Yasmin is a public health professor at UT Dallas and a staff writer at the Dallas Morning News. So, Dr. Seema, let's start with the procedures and how they might have changed in Texas after this, what has to be called a bungled first response to this Ebola case.
So the hospital tells us that the electronic medical record system is what was flawed. They're saying that the nurse did ask the patient about the travel history, and the patient volunteered that information that, yes, they were from Liberia. We're told, though, that the nurse's workflow, as they called it, was separate to the medical workflow that the physician had access to. And so that's why that information was not relayed to the entire medical team. However, as a physician, I can say that no healthcare worker should be relying on someone else to take a history, and that the physicians should be taking a travel history, especially now when the CDC has offered guidance saying that the travel history is a crucial question to be asking at this time.
And Dr. Yasmin, I think a lot of people would find that really alarming, because even if you go in just feeling ill or having the flu, you assume that the nurse or the nurse practitioner who sees you, when they put notes in, that those notes eventually go to the doctor. Is this a case where, in this instance, there was a failure of those two systems to connect, or are those two systems always this separate?
They're not always this separate, actually. We've talked to many local hospitals who say this isn't how it works for us. And in fact, they've, since August 4th, when CDC offered guidance about taking a travel history, many local hospitals have said we have these automatic screening questions that come up all the time in the ED for anyone who triages or speaks to a patient. So other hospitals in the area are asking those crucial questions.
And let's talk now about the cleanup, because that's the other alarming thing. 4 days this family was basically sequestered in this apartment where you still had the bed linens and other things that were used by this man. Has that procedure changed, or is there some sort of an official procedure to have a professional, competent entity remove those sheets, those beddings, and things like that?
Well, of course, any soiled clothing or bedding has to be discarded in a very proper manner, and there are guidelines to do so. We've been told that a hazmat crew was deployed to clean up this mess, but of course, many local residents are asking why there was such a delay. We know this is a very collaborative process. There are many agencies involved in this response right now. There's a local public health, there's state public health, and of course, there's a CDC as well. But there are guidelines about how to discard those kinds of biohazard materials.
And that's assuming you can, of course, find a contractor willing to undertake it. A very troubling case. Dr. Seema Yasmin, thank you very much.
Thank you.
NBC's Charles Hadlock joins us live outside Eric Duncan's family apartment in Dallas. So, Charles, we are hearing that the CDC is now making progress narrowing down the list of potential contacts. What can you tell us about that?
Yeah, they have narrowed the contacts down to about 50. Now, that doesn't include the doctors and nurses at the hospital. But the latest news is here from the apartment complex. The city of Dallas is now on site with the fire department hazmat team, along with a private company, to disinfect this apartment unit. So what will happen to the family? We've just learned, this is new to NBC News, that the family will be moving out of this apartment sometime this afternoon to an undisclosed location. The location is not a medical facility, but another housing place somewhere in Dallas County. That's all the PIO can tell us, the public information officer for the city of Dallas could tell us at the moment. They are going to clean up this apartment. We asked why they are moving the family out at this time, and they said it's simply because the families around the apartment unit are concerned, and as a measure of safety and just to ease everyone's mind about what's going on here, they're going to move them out of this apartment complex later today.
But Charles,
Back to you, Joy.
it sounds as if you're saying that they're going to move them into another complex where people wouldn't even know that they were coming, and you're saying that this is not a medical facility. They're moving them to another private apartment complex?
That's what we're told. It will not. I asked that question specifically. Will they be moving to a medical facility? And they said they are not moving to a medical facility, but another housing place in Dallas. They didn't say whether it was a house, an apartment, a condo. We don't know.
Wow. Charles Hadlock, thank you very much. Appreciate it.
Sure.
Cindy Zolnierek is Executive Director of Texas Nurses Association. So thank you for being here, first of all.
Thank you, Joy.
And Ms. Zolnierek, let's start. There was a statement that was issued by the Texas Nurses Association that essentially said that when something is missed or goes wrong, we need to ask why and how. Blaming individuals is counterproductive. Worse, it can distract from the central question, which is how can we prevent this from happening again? That was a statement from your organization. But wouldn't the simple question to answer to that be to have the nurses system that she inputs information in connect to the doctor's system? Why didn't that happen?
My understanding, it was a system design issue that the two, even though both parties, all the team members are following protocols, that somehow the way the system was designed, they didn't communicate in that manner where the information the nurse entered was available to the physician when he was making his or her clinical diagnosis. That is not, I mean, that is a risk of electronic medical information systems, and that's why nurses, there are nurse informaticists who are very aware of these potential issues and are very active in trying to address them and make sure nurses are aware of potential issues in systems, in documentation.
But this is not a documentation issue, but with respect, wouldn't in a case like this where a patient is presenting with the symptoms of Ebola, Texas is one of 13 states that was supposedly certified to be good to go in terms of dealing with potential Ebola cases, wouldn't it have been incumbent on the nurse to not just enter information into the computer, but to say, hey, raise the red flag, doctors, we need to pay attention to this, and to verbally make sure that people understood the gravity of the situation?
I think that when you depend on systems to collect that information, there was a protocol, the nurse was following her protocol. We've learned a lot from this situation in terms of that, indeed, that the systems weren't communicating. I don't know that that had been identified previously. I don't have that information. Now that it's known, my understanding is the hospital has fixed it. And it's also been an alert to many other health systems to look at their systems and make sure that they don't have a similar flaw, so that they can also make sure that nothing slips between the cracks.
But we're talking, we're still talking about the sort of the computer system or the system of inputting information. But as a lot of people who go to doctors' offices and go to hospitals know, you're primarily dealing with nurses. There aren't doctors that are seeing you right away. You're really dealing with nurses and nurse practitioners. Shouldn't there be more than just inputting systems? Shouldn't it also be incumbent on the health professionals, whether it's the doctor or the nurse, to alert the people around them, just for the safety of the people they work with, and to say, listen, this is a very serious disease. If someone says, I've been to West Africa, shouldn't there be more than just inputting into a system?
Well, what's incumbent upon the nurse is to communicate the information and the assessment that the nurse completes. The nurse used the electronic medical record to communicate that information. The system, the electronic medical record system, to my understanding, did not communicate that information in the manner the nurse anticipated that it would. I don't think you can fault the nurse in this case, and I don't think it's useful to do so, because it's more important to identify the system issue because that has ramifications throughout the country as hospitals struggle to be prepared in case they encounter a patient with Ebola.
And just the last question, are the nurses, the Nurses Association, are nurses being briefed on the potential severity of Ebola itself? Because I think if you had a sense of the gravity of the potential case, then a nurse wouldn't simply input. They would actually walk up to a doctor and say, I believe we have a case that may present at least the symptoms of Ebola, or someone has been to West Africa and is sick, and actually cue the doctor to take action right then and there, aside from the system.
I believe that nurses are aware of public health threats such as this one. This is an infectious disease process. Nurses are aware of threats from infectious disease and how to respond to infectious disease, and they use systems within their organizations to respond, as was done in this case.
All right. Well, thank you for being here, Cindy Zolnierek. Appreciate you being here.
Thank you.
All right. Thanks.